Hey y'all, Shelly here with another tip for hospice nurses. When you have a patient who's got an end-stage pulmonary disorder like COPD or lung cancer or fibrosis, they can sometimes get into this cycle where they'll start out with some increased shortness of breath, which causes them to have increased anxiety, which is understandable. But the anxiety causes the shortness of breath to get worse, which causes the anxiety to get worse. And they get into this cycle that ends up with just extreme air hunger. Very, very stressful for the patient, very stressful for the caregiver, and really very stressful for everyone involved. Well, one of the things I found that works well for this that we used to do a lot and you don't see too much anymore is nebulized morphine. You just put the morphine into the nebulizer, you take one of your sterile saline bullets and you squirt that in there as well, and they nebulize it. They breathe it in through their breathing treatment. And it works, it'll start almost immediately to relax the bronchioles, make it easier for them to take a deeper breath. When you combine it with their anxiety medicine, especially with the ABH, if you're having them do their nebulizer while the caregiver's rubbing the ABH gel in on their arm, all of these actions can result in a much more soothing effect on the patient, bring their anxiety down, open up their airway. Usually in about 15 minutes, they're going to have a very marked improvement in their breathing, and they're much more comfortable, and the caregiver's much more comfortable, and everybody feels better. Talk to your doctor about it. Talk to your palliative pharmacist. Most of these pharmacies can now provide the morphine in sterile single dose syringes that you just squirt in the nebulizer and get a sterile saline bullet and put that in. It provides a lot of comfort for your patient. I hope this tip was helpful. If you have any tips that would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.